My cancer journey started in Woodland Clinic with Dr. Stewart with a high PSA score, and I was referred to Dr. Powell here in Carrollton. So I came and discussed the options. I actually had a biopsy in his office, and 20% cancer, prostate, 20% of it affected. So
Mr. Howell's cancer was diagnosed about 4 years ago. We diagnosed it with elevated PSA. A PSA is a blood test, and elevated PSA can be caused by inflammation or enlargement of the prostate, infection of the prostate, or even prostate cancer. One of the interesting things at Tanner is that we have access to some of the more advanced screening techniques, and some of those include MRIs of the prostate or even genetic screening tests.
I was shocked when I got my cancer diagnosis. I said, you expect it to happen to other people? I should have been expecting it. My dad had cancer, prostate cancer, and my uncles had cancer, so it does run in my family. Until it actually happens, that's when you get the slap in the face that it has happened to me.
Prostate cancer is very common. It's one of the most common cancers in men. Early detection of prostate cancer is super important because if we catch it when it's still confined to the prostate, treatment options are very successful. Most patients who have prostate cancer are diagnosed before they ever develop symptoms. If you have aggressive or late-stage prostate cancer, you can have symptoms, and some of those include trouble urinating or blood in the urine or ejaculate, bone or back pain, or unexplained weight loss. Certainly, if you have symptoms and you think that you may have prostate cancer or need to be screened for prostate cancer, you should contact your physician.
What I really like about Dr. Powell is his mannerisms and his straightforward options. He tells you the options and the results of these options and what could happen and what will happen and what he knows. But it really makes it a lot easier to understand what you need to do at the time. And at the time you're really confused because you need help figuring out what you need to do.
I think when a patient is diagnosed with cancer, that's a scary time in their life, and I think uncertainty is the worst part of that. At Tanner, our cancer care specialists understand that waiting is not an option for most cancer patients, so we'll make you a promise. We'll see you within 3 days of your diagnosis. Within those 3 days, you'll meet your cancer care specialist. They'll answer all your important questions. You'll learn about what your treatment options are, and we'll develop an individualized plan for you.
And there were 2 or 3 different options, and I decided on the robotic surgery, which completely removed the prostate. And he's a specialist at the robotics, so that's his specialty, and he did that. And that all turned out well. About a 12-week recovery period.
Robotic technology is far and away much better than open surgery, and the big reason is blood loss and hospital stay. We lose about 1/10 of the blood that we would open when we do a procedure robotically, and most of the time patients are in the hospital overnight, whereas with open surgery it's probably about 3 or 4 days.
Less cuts, less pain, quicker recovery, and so that's why I chose that. But if it's just our local hospital, that's just where we go.
I think that being straightforward with cancer patients is really important. I think they're going through a tough time in their life. It's a time of uncertainty and fear. I think it's an important time to try to empathize with the patient and talk to them about what their options are. In Mr. Howell's case, I think it was important to talk about what I would do with my own family in this situation. I think that's certainly how I try to approach patients is what would I want, what would my family want, and give them options with that in mind.
The best advice for people is to stay current on their PSA test. Your doctor can tell you how many months you need to go according to your family history, and the family history has a lot to do with this type of cancer.
Early detection of prostate cancer is very important. If you're over the age of 50 or you have a strong family history of prostate cancer, please ask your physician if screening is appropriate for you.